Hello, and thank you for visiting Optimal Anesthesia, your gateway to the fascinating world of anesthesia. Today, we'll be discussing laryngospasm, a serious issue in the field of anesthesia. Anesthesia providers must be familiar with the subtleties of this potentially fatal complication that might arise during the perioperative period. In the field of anesthesia, laryngospasm poses serious risks. In the worst situations, this complication may cause mortality by causing bradycardia, negative pressure pulmonary edema, cardiac arrest, pulmonary aspiration, arrhythmias, or all three. Therefore, it is critical for anesthesia professionals to be proactive and well prepared. So, let's go into the anesthetic realm and learn everything there is to know about laryngospasm. We've broken it down into three simple categories: patient-related, surgery-related, and anesthesia-related factors. Stick around, because you're about to learn some eye-opening insights that might just save a life someday. Let's kick things off with patient-related factors. These are the aspects of a patient's health and lifestyle that can increase the risk of laryngospasm. First up, we have obesity. Yes, it's a well-known risk factor for various health issues, and laryngospasm is no exception. We'll explore why excess weight can complicate things in the operating room. Smoking, an unhealthy habit that has numerous detrimental effects on the respiratory system. But did you know it can play a role in laryngospasm too? We'll explain how. Young age, surprisingly, youth can also be a risk factor. Find out why young patients are not immune to this condition. Gastroesophageal reflux, it's not just heartburn. This condition can lead to some unexpected complications during surgery. Moving on to surgery-related factors, these are specific procedures that can increase the likelihood of laryngospasm. Nasal, oral, or pharyngeal surgeries. What do these surgeries have in common, and why are they on our list? GI endoscopy and bronchoscopy, these may sound scary, but we'll break down the risks and help you understand why they're here. Anal or cervical dilatation, intrigued? You should be. We'll unravel the connection between these procedures and laryngospasm. Inferior urologic surgery, it's not just about where the surgery happens, but what happens during the surgery. We'll tell you more. Last but not least, we have anesthesia-related factors. These are elements of the anesthesia process that can influence the risk of laryngospasm. Extubation, the moment when the breathing tube is removed, sounds simple, right? Well, it's not always that straightforward. Blood and secretions in the airway, a recipe for potential disaster during surgery. We'll explain how this factor increases the risk. Regurgitation, it's not something you want to happen when you're under anesthesia. Find out why this can lead to laryngospasm. Desflurane, ketamine, and thiopental induction, what do these drugs have in common, and why should you know about them? Nasogastric tube, a seemingly innocent tube, can be a game changer in the world of laryngospasm risk. We'll tell you how. It's a reflex that could be your lifeline, yet remains shrouded in mystery. Picture this: you're in the operating room, and out of nowhere, your patient's vocal cords slam shut, cutting off the air supply. It's a life-threatening situation, and you're left wondering, how and why does this happen? Well, it's all part of your body's remarkable defense mechanism. So, let's break it down. Laryngospasm is like the vigilant sentry at the gateway to your lungs. When it senses trouble, it slams the door shut. But what triggers it? There are three primary categories. First in line, we have mechanical factors. This is when your airway gets physically irritated, such as during the insertion of an endotracheal tube. Next, we have chemical factors. Exposure to irritating substances like gastric contents, blood, or foreign particles can trigger the alarm. And finally, there are thermal factors. Extreme temperature changes or contact with hot or cold substances can also stimulate this reflex. But how does your body detect these triggers? It's all thanks to some extraordinary specialized receptors in your larynx, known as laryngeal mucosal receptors. They're akin to the watchful guardians at the entrance to your vocal cords, constantly scanning for trouble. These receptors can detect a wide array of stimuli, including touch, chemicals, and temperature changes. These receptors are connected to your brain through a complex network of nerves. It's like an intricate communication system. When they detect an issue, they send a message via afferent nerve pathways to your brainstem. Specifically, the afferent pathway primarily involves the superior laryngeal nerve, a branch of the vagus nerve. Now, let's talk about your body's brilliant processing center for these signals, the solitary tract nucleus in the brainstem. Think of it as the control room for reflexes, including upper airway reflexes. It's where the magic happens, where signals are analyzed and decisions are made. And the messages don't stop there. Your brainstem then dispatches efferent nerve signals via the recurrent laryngeal nerve, another branch of the vagus nerve, acting as the conductor of this life-saving symphony. The star performers in this symphony are the vocal cord muscles, including the lateral cricoarytenoid muscles, thyroarytenoid muscles, and cricothyroid muscles. When they contract in unison, they bring your vocal cords together, sealing off your airway. That's laryngospasm in action. In a nutshell, laryngospasm is your body's way of shouting, "No entry," when it senses trouble. It's an intricate symphony of sensory receptors, afferent and efferent nerve pathways, and precise muscle movements working together to protect you. Understanding this intricate process is critical, especially in the realm of perioperative care. It can make the difference between a smooth surgery and a perilous situation. So, the next time you hear about laryngospasm, you'll know it's not just a random occurrence, it's your body's superhero reflex, poised to defend you when you need it most. It's all about recognizing the signs, utilizing monitoring equipment, and relying on the expertise of our vigilant anesthesiologists. So, let's get started. Picture this: you're in the operating room, and everything seems to be going smoothly. The patient is under anesthesia, the surgical team is focused, but then, out of the blue, a strange, high-pitched sound pierces the air. That sound, my friends, is inspiratory stridor, and it's the first sign that something's not right. So, what's going on? Well, it could be laryngospasm. Laryngospasm is like your body's way of saying, "I'm not happy with something down here in the airway." When the vocal cords suddenly clamp shut, it creates this crowing sound during inhalation. But that's not all. Patients might also exhibit something called paradoxical respiratory movements. That's when they're really struggling to breathe, showing retractions in the chest or upper abdomen during inhalation. It's a telltale sign that they're working hard to get that precious oxygen. Now, as an anesthesiologist, you're not just relying on your ears and eyes. You've got some nifty tools at your disposal to help diagnose laryngospasm. One of these tools is pulse oximetry. It's like a tiny, magical device that continuously measures oxygen saturation in the blood. When those vocal cords start acting up, the oxygen levels might drop, and that little device starts beeping like crazy, alerting the anesthesia team. But that's not all. There's another gadget in the toolbox, and it's called end-tidal CO2 monitoring, or capnography. This handy device tracks the levels of carbon dioxide being exhaled. When laryngospasm strikes, the patient might not be exhaling much CO2, or you might see a sudden drop in those levels on the screen. And here's another vital sign you'll be keeping a close eye on: blood pressure and heart rate. Laryngospasm can send these numbers into a frenzy, like a symphony conductor trying to control a chaotic orchestra. Bradycardia, a slower heart rate, might be your clue. Now, here's where the magic happens. It's not just about the gadgets, it's about the skilled hands and keen eyes of our anesthesiologists. The anesthesiologist is the captain of the ship. Their expertise and vigilance are the secret ingredients in this recipe. They know what to look for, and they're quick to respond. They can recognize the signs, assess the patient's response, and take swift and appropriate action. It's like they're the Sherlock Holmes of the operating room, solving the mystery of laryngospasm. They know that early recognition is absolutely crucial. It's all about keeping the patient safe and ensuring that surgery goes as smoothly as possible. In the world of anesthesia, laryngospasm is like a sudden storm on a clear day. But with the right knowledge, the right tools, and the right people, we can navigate these turbulent waters and keep our patients breathing easy. We're going to take you on a journey through the structured approach to managing this critical condition. But don't worry, we'll break it down into easy-to-digest steps, just for you. Step 1: Identification and removal. The first thing you've got to do is figure out what caused it and remove the trigger. Think of it like solving a mystery. Was it the endotracheal tube irritating the airway, or perhaps an allergic reaction? Find the culprit and eliminate it. Step 2: Call for help and delegate. Now, when you've got a laryngospasm situation on your hands, you can't do it alone. Call for backup. This step is all about teamwork. Delegate tasks to the medical team, so everyone knows their role in resolving the crisis. Step 3: Assess airway entry. Next, assess the airway entry. Think of it like a security check at the airport. You need to know how bad the situation is. Is it a minor disturbance or a major crisis? The extent of the laryngospasm will guide your actions. Step 4: Gentle maneuvers. Time for some gentle maneuvers to break the spasm. These are like the secret techniques of anesthesia, like lifting the chin, jaw thrust, and even temporomandibular subluxation. But don't worry, we're not getting too technical here. Step 5: Deepen anesthesia. When gentle doesn't cut it, it's time to go deeper. We're talking about administering propofol, a little dose to send your patient into a deeper level of anesthesia. Step 6: Muscle relaxants. If the laryngospasm is still holding on, consider bringing out the big guns, muscle relaxants like succinylcholine. These can help break the spasm and restore normal breathing. Step 7: The thoracic pressure or Larson's. Sometimes, you need to get a bit creative. Apply some gentle thoracic pressure or try Larson's maneuver, which can induce pain and potentially relax the vocal cords. It's like a secret handshake in the world of airway management. Step 8: Intubation or surgical. If all else fails and laryngospasm is playing hard to get, it's time to consider orotracheal intubation, cricothyroidotomy, or tracheostomy as a last resort. These are like the emergency exits in an airplane, used only when absolutely necessary. And now, for the follow-up. Patients who experience laryngospasm should be closely observed in the recovery ward for 2 to 3 hours. It's like keeping an eye on a simmering pot to make sure it doesn't boil over. We need to ensure a clear airway and exclude complications like pulmonary aspiration and post-obstructive pulmonary edema. So, there you have it, a structured approach to managing laryngospasm. It's like following a well-choreographed dance routine in the world of anesthesia. Remember, it takes a team, some secret maneuvers, and a cool head to navigate through this challenging situation. That's all for today's episode of Optimal Anesthesia. We hope this deep dive into laryngospasm in the context of anesthesia has been informative. Remember, in anesthesia, knowledge is the key to exceptional patient care. Until our next episode, stay curious and stay committed to delivering safe and effective anesthesia.